Okay, well now we have an opportunity to do some questioning, some in-depth questioning and some planning. I'm hoping anyone who's walked in more recently is sitting in their relevant state groups, because we really are hoping we can use these sessions to actually progress things forward. So we have, Savannah has a microphone somewhere, and we need another person to help her. Denise? Great. Okay, so that everybody can hear the questions, if you have a question to ask, if you could just throw your hand in the air and I'll nominate and they'll bring a microphone around to you. So who would like to ask a question? Tim?
Hi, Robin. I just wanted to ask, given you've got 48 SPCAs there and you started last year with Saving Lives, are you still finding little pockets of resistance in various places to what you're endeavouring to do?
It's really interesting. We expected to get a lot more resistance than we have. So we officially launched only a year ago, and that was a pretty difficult meeting. We have an AGM where most of our SPCAs come to, and we give them the good news or the bad news. And the good news was that we had Nathan there, and the bad news was that their food allocation, because we get we've got about $500,000 worth of food that goes out to SPCAs, and at that meeting we told them that actually we would only give food for live animals. So if they were putting 1,000 animals through their centres and they were killing 500 of them, actually they were only going to get food for 500 animals. And that way we believed that we could encourage a positive number. But we've probably, I can name 2 out of 48 of our SPCAs that have basically resisted change. They're not larger SPCAs, but one of them, Sarah and I visited the other night and met with the whole committee, and in a large and very new shelter, they had 5 animals, 3 cats and 2 dogs. And there was a little doily in the middle of this beautiful board table, and it didn't look as if there'd been an animal anywhere near the place in months. And we'd just taken steps to remove their gas chambers, where they were providing a service to the community. If you came in with your pet that you wanted euthanased, mainly cats, but dogs as well, they would do that job for you for $45, and they would either gas it if it was a cat or shoot it if it was a dog. So that has stopped, but we can't say that we've had great success with them. And then we have a small SPCA down on the west coast that really doesn't want to talk to us about saving lives, but other than that, 46 out of the 48 SPCAs are actively involved with us, and I think that that's amazing, and it was way, way more than we thought that we would achieve.
Next question. Mark, is this on as well, please? Okay. We've got Jackie Rand, please.
Hi, I'm Jackie Rand for the University of Queensland. This is a question really and I guess a bit of a statement and a question for Richard. I was very pleased to hear you say that you thought it was very important to have shelter programs in universities, and some of the data that we're going to present tomorrow really suggests that some of the most effective deployment of resources is in training veterinary students, so that if every veterinarian that graduates goes out with hands-on skills of early age desexing, is competent doing it, and has spent time in shelters to really see the magnitude of the problem facing shelters every day, then when they go out into practice, they're going to be selling that and marketing that to clients every day, encouraging them to include it in their initial health profiles, particularly for cats, so vaccinate, and desex. They're also going to be much more proactive in preventing behaviour problems in dogs and cats, as well as giving advice to clients about where to get their next pet. And so we've got the first program at the University of Queensland where all our final year students are spending 2 days in the RSPCA 2 days at the Animal Welfare League, and we're very grateful to the support of those shelters, and 2 days of face-to-face teaching, which has been provided by sponsorship from a donor. However, our vision is that every veterinary school in Australia, and we have now 7, so we'll be graduating about 700 potential veterinarians that are going to be able to do early age desexing if they get the training. But we don't have the funds. Veterinary schools are actually in worse situation financially than the shelters are, because we get so much less funding per student than US schools. So my question to you, Richard, do you see the Maddie's Fund expanding their horizons internationally and incorporating that model in other countries?
Well, thank you for the question, and congratulations on the work that you're doing. For the audience, somewhat related to this is I usually bring $1 million in my briefcase. Those are U.S. dollars for the people who stay to the end of the conference and listen to everything that's being said. But if you guys want to go home early or don't want to listen, it's okay. Getting back to your question, right now we are focused on creating what we call the No-Kill Nation by 2015, and all of our resources are going into saving the dogs and cats of America. The generosity of our benefactor, however, is extremely large, and I definitely see us having an international program at some time in the future, but certainly not before 2015, because we are laser focused on guaranteeing all the dogs and cats of America a loving home.
Can I just add that we have in Wellington, SPCA, they have veterinary students coming in, and it's actually put as part of their course, and they pay Wellington to have them come through, the students come through. So I think maybe either you don't get as much funding for your veterinary students there, or they're telling you big stories because it's teaching time, and basically it should be able to be funded as such.
Okay, another question? Up here to Peter.
Hi, Peter McQueen from Auckland SPCA. One of the big issues with the Asilomar Accords and a few of the other things, and it's probably a question for Joy as well, is the definition of healthy, treatable, and to try and move away from the focus on euthanasia numbers to save. And where do you see that going in the very near future?
As I said, the Asilomar Accords was a collaborative effort of 18 organizations who had a variety of different points of view of how to achieve our goal. And so it was a compromise document. I equate it naively and probably inappropriately to the creation of the Declaration of Independence in America. 13 colonies that came together to create a written document for a structure for our nation. It was flawed. It was developed by slave owners, and it didn't recognize women as having any rights at all, and a lot of other horrible deficiencies, but it was a beginning. We look at the Asilomar Accords as a beginning document. In terms of treatable, the consensus of the group that adopted the Accords was that we wanted to have a standard of care as a very minimum in shelter operations equivalent to what the community wanted to do for their own pet. In other words, we thought the standard wasn't what the most expensive medical practices could achieve, or what the shelter could afford, or what the community wanted to do about pit bulls. It was all about what does the average pet owner in your community invest in to save their own pet, which is a family member. That was the minimum standard. So the minimum standard of the Asilomar Accords treatable is based upon involving local practice veterinarians, shelter workers, pet shops, and animal lovers in defining what is a treatable animal. The University of Iowa State University went out and surveyed all the veterinarians in that state and developed what we think is a very good matrix classifying the various animal diseases. What happens many times is shelters develop the matrix, And that's usually based upon what they see and what they think they can save with the resources they have. That's not the standard of the Asilomar Accords. The Asilomar Accords basically is a community standard. Now, if you follow that path, however, it is flawed because each community is different. There's a different standard probably in the South than there is in the East in our country. But it is a beginning. And I think once you start putting out information and you start tweaking and fine-tuning the way you want to see statistics developed, handled, and reported, you can make some improvements. But I felt good of being a participant in that process because I think it had to start somewhere.
And from our point of view, I know that I'm not saying ours is perfect either, but it was really tremendously valuable to be able to, instead of just having all these animals being lumped in together, we knew that the majority of those animals were treatable animals. It was not difficult to tell the majority of them in the normal caring home, which is our guideline as well, would be treatable. There is, I believe, still, from my personal point of view, that there's still probably some animals in our untreatable category that should be in the treatable category eventually, or should even be now. But I don't think we should not do it just because there's going to be a little bit of a borderline there where, you know, you won't determine it. And I know I've been talking to RSPCA, Heather Neal and Mark Townend and so on. We're working towards, trying to get some consistency between Animal Welfare League and RSPCA, because RSPCA also acknowledged that by having, at the moment in their stats, they've got medical, behaviour, the groups that were euthanased for medical, groups that were euthanased for behaviour, and ones that were for no room, and that allows a distortion of the figures by people who want to say that the majority of cats and dogs in pounds and shelters are not rehomable. And that's come from some areas within the pet industry to try and justify the fact that we haven't really got a big problem. So to me, it's really, really important that we all start working down that track, but have the discussions about what's treatable and untreatable, and let's keep negotiating that borderline. It won't necessarily be locked in. It just needs to be that it's pretty obvious that there's an awful lot of animals that are fully treatable in our pounds and shelters, and they should be acknowledged as such. And so that we can clearly see how far we have gone down the track. And until you do that, you don't realise how many you still have to go or where you're up to, because it's all confused in, the topics of age or flu or whatever, but nobody knows how severe that was or how bad that animal really was, or whether they had multiple conditions. Like in our untreatable category, we have the ones that have so many conditions that all combine together to make it a really, really sick animal. So you don't have any way of gauging that unless you go down that track.
If I could add one more thought to this. First, in saving all the healthy and treatable doesn't mean that that's where you stop. First, in our view, it's a community standard. You want the shelter and rescue world to be doing, as a minimum, what the community is doing. But that doesn't mean you stop there. A lot of communities are going above and beyond what would be healthy and treatable. In the area of unhealthy, untreatable, animals that are actually public health dangers are sometimes put into sanctuaries. Their lives are still being saved. They're not being put out on the public streets, but the animals are still finding a care center where they are being watched over. And lastly, on the community standard, we think it should be published. It should be on the websites of the organizations that are participating, so that the community can say, oh, that's a condition that I think is definitely unhealthy, or no, I think that is definitely treatable. I mean, you've listed it as untreatable, and let me tell you, there's 15 people here that say it's absolutely. So that creates the dialogue. And when you get the veterinarians involved and the community involved and the animal lovers and the benefactors and the contributors and the boards of directors all offering their 2 cents worth about your definitions, I think you have the best chance of coming up with a formula and a plan that reflects not just what a single agency feels, but with what the community feels as a whole.
And just on the healthy animals, we started off 2 years ago where a lot of animals were being euthanized simply for space, and we also were aware that a lot of animals were being used for space, but it was for ringworm or upper res, which was imminently treatable. But if you're in a situation where you haven't got an isolation, then that's really hard. So our first goal was actually to not be euthanizing for space anywhere. And I think that very largely we have achieved that. We had a puppy, what they called a puppy mill, but it was just a bad breeder. The other day, about 40-something animals in one of our very small towns, and all of those animals have been dispersed around SPCAs throughout New Zealand, and they will be adopted. And when we had the earthquake, we put out a press release which said that every single animal that was picked up over the period of the earthquake would be homed. And we achieved that, and I think that some of the strays that were out the back of McDonald's in Christchurch have now got lovely homes up in Whangarei. So, you know, it's just, you have to state it, and you have to be really clear that it did happen, but you're working towards it not happening. And certainly the ringworm and the upper rest, we can't say yet that all SPCAs are not using for that, but we've said loudly enough that we don't, you know, that's our goal, for that not to happen. So I think it is a bit of one step at a time. Some of the SPCAs have been able to do it much before others, and a lot of that depends on their size and their fostering capabilities. But there's a way, and it's all about saying that you're not going to do it, or saying that you're going to do it. That's the way that you'll get donors helping you.
Now, I don't know whether there's any more questions that are urgently, but we only have 15 minutes left now in our time frame to have some discussion. And what I would love to see some discussion on is one of these areas, like, for example, healthy, treatable and untreatable. How far down the track is it from all groups being able to actually start to report based on that, or anything else that you've heard in the Getting to Zero model, or the Saving Lives model, or the no-kill programs that you've just heard about. So you've got a sheet of paper on your table now. I was just wondering if you could all just spend 15 minutes having a bit of a discussion about, you'll see there's 3 topics on that page. We don't need to do a page per person. It can just be a page per the group in your city or shire, knowing that for community change to happen, the best place to start is in your own community, so maybe 1 per community. And just think about all that you've heard this morning in a general sense about the strategies that are being used. And I think there's 3 categories for you to comment on. The first one was, what do you think you're already doing well? Secondly, what do you think you need to work on out of all the strategies you've heard about this morning so far? And the third thing is, well, what's your plan? What's realistic about what you personally could go back and start to do to progress whatever you think needs to be done out of the list? Just so we get up with some practical things, and if we can throw these later on onto the Getting to Zero website, we'll have a bit of a plan for the next 2 years about where we would like to go. Does that sound okay? Yeah? Okay.